Okay, so this is basically my regional paramedics experience. You're gonna hear me have a discussion after on a maybe a training experience of, I would say, probably 4 shifts or so. I was basically ambushed essentially by the patient community, which is a common deal, and ambushed by the employees, if you will, the employer in this case. And on my 35th birthday, July 6th, you'll see I have a picture of me on the helipad here. And on that same particular day, they waited until about 6 o'clock to send me to a call. And around 6 o'clock that evening, I was confronted by a woman, a patient's family member, essentially, while we were not even treating, we were interviewing a patient. And long story short, the quote-unquote trainer at the time, Travis, quote-unquote FTO, and Megan were part of this, where they turned on me, and I was supposed to be basically leading and having interactions to basically, facilitate this call. And again, they use this disarming technique, where they tell me that I'm gonna go and begin the call and finish the call. I'm gonna lead the call, I'm gonna do the call, basically. And when they say, yeah, you can do this call, what they'll do is they'll wait for me to start initiating interaction, and they'll wait for me to start initiating conversation, and then what will happen is they will start disarming me. They'll start interrupting me, interfering with questions, and they'll just go on about the call and act as if I'm not there. And what this does is this facilitates closed-end questions. So if they're interrupting me, or I'm asking certain things or getting ready to initiate certain things, again, they'll do this disarming tactic where they will act as if I'm not there, essentially. And so in this case, this led to me asking a few closed-end questions regarding transport to both the family and the patient. And the lady asked me to leave the house, and either way, he was going to go to the hospital. And this gentleman was smiling, and he had walked from point A to point B through the house. And long story short, there was a complaint of him being weak and falling, and he had some recent, I think it was some type of genital urinary surgery. The discharge papers and the surgery does elicit that there would be some complications 3 or 4 days afterwards. All of the things that we would also do on assessment to facilitate an understanding of emergent versus non and stuff like that, we completed. But long story short, things didn't work out, and there was a facilitation of this family member, for some reason, to be on the extreme spectrum of interpersonal skills. And long story short, what you're going to hear now is me having a discussion, like, I think 3 or 4 days later, where I have to talk about it. And I'm just going to leave this here for now, and then I'm going to break it down, because there's so many things in here that are just wrong. A bunch of things that I don't have the time. I don't really want to spend the effort because it's Saturday. And we're just going to break this down just like we did Shoals Ambulance, and show you how the subversive tactics of you're always wrong and always disarming, these are tactics that they perpetually use. So even though you're right legally, even though you're right morally, even though you're right ethically, because they're on this campaign of oppression, it's always about disarming you. It's always about telling you you're wrong. It's always about setting up and fabricating issues, which are then later questioned as if that as if it makes sense, as if it's supposed to be right, you know, and the rationale behind it is completely irrational. And so anyways, I don't want to get too far into this because I try to listen to it and dissect it, and I realize that there's so much to dissect, so many things going on here, that I just don't have the time to do it all in one video. And I'm going to have to make a series on this, but I'm going to leave this here because I know that they're always removing evidence. I'm also looking at dash cams without GPS and without Wi-Fi. Okay, so here is that. You're going to see a photo of me that morning, okay, talking to the flight nurse and the flight medic and one of the ex-captains of the local fire departments at that particular area of time in the morning. That's who I was speaking to. So they're kind of buttering you up and everything and putting you on this emotional roller coaster of satisfaction, right, and conformity to your new organization. And throughout the rest of the day, we go on these calls where Megan and Travis, or especially Megan, rolling their eyes about people who are complaining of chest pain but don't really have the signs and symptoms, aren't really very distressed, giving you this impression, right, that they're kind of have that mental fatigue, that provider compassion fatigue, right? This goes on throughout the whole day, okay, the whole morning, the whole afternoon. They start kind of expressing, you start seeing their true characters, and then there's a lot of radio static. So I'm going to get into that whole piece because this is a Saturday as well, July 6th was, and I'm going to give you the backstory on that on another video. So here is the full debrief that, contrary to Mr. Praytor's inquiry about why I didn't contact him or why I didn't contact Mr. Bailey, the other supervisor, when in fact I'm the one that called the debrief immediately after the call. And I think I even called on scene to Cammie, which was the day supervisor at the station, okay, one chain of command below these two gentlemen, Mr. Praytor and Mr. Bailey. Okay, so anyways, I've got a lot to say. A lot of things don't make sense here. This is the subversion. This is the oppression that you're going to see. Notice every time I say something in this video, there will be a disarming reflection. There will be a purported, you know, we're just too complex. And it's this perpetual rhythm of I'm not doing things right. My perception is wrong. And I'm going to leave it at that.
I'm alright. I appreciate it.
No worries, no worries. Alright, let me let them get in there and we'll touch base with you about the last day that you worked. I just don't want to sit here and ask you about it because then you're going to have to explain it when they come in here, so
Okay.
we'll just hang tight for just a second. What part of town do you live in?
North Birmingham.
North Birmingham, okay.
Yeah, still like 33 miles, even going on 22 here.
Yeah.
I just come off of a shift too, so.
Where are you working at?
I'm doing some nursing stuff.
Okay.
Yeah.
So are you a registered nurse?
I have a nurse registry, but I'm not an RN right now.
Okay. So what nursing stuff are you doing?
Just
CNA
basic.
type
Yeah,
stuff?
just basic
Okay.
stuff. Yeah. And working on some tutoring and some academic things as well with Mometrics varsity tutors.
Okay. I'm trying to figure out, get out of everybody's way. All right, Michael, we just touched base with you about the last shift that you worked and just seeing what was up and what was going on with it. And the situation with you and the family and that sort of thing.
Yeah, let me get this paper out too. Are you aware of who I was working with? Are you aware of me speaking with Miss, I believe,
Kim?
Hi.
Was any of that information relayed to you?
No, go ahead and tell me what you talked about that, because I understand that you talked to her and talked to her about the ethics and stuff in the state of Alabama.
Okay, just wanted to make sure.
But I'm not sure where it went from there. So.
Okay. So let's just do a brief, like an S-bar, if you will. You know, just something brief.
Okay.
So the first thing was, it was a Saturday, 0600, my shift 0600. And I was working with Megan and Travis.
Okay.
And Saturday was busy.
Mm-hmm.
A lot of radio chatter, multiple cardiac arrests. We had a big accident with, I guess, another ambulance here, RPS, right at 5:30 in the morning with a drunk person. So we had a busy day.
Mm-hmm.
We were going to be busy running all day. I was training, still am training. Technically, I don't have verification via, I think, FTO or medical direction, but we're working on paperwork.
Mm-hmm.
So I was asked twice to take the lead by Travis. So he's like, look, I want you to run this. You know, I shadowed him a little bit throughout the day. Leading up to this, we had a seizure call. We had what he called a regular, him and Megan, which was chest pain and whatnot. So I got acquainted with Walker County. A lot of chatter. That's very important as I build up to what's going on. So we get to this particular scene.
Okay.
Older woman is sitting outside. We were dispatched for a fall. There was no preliminary information from Mr. Day about what I needed to grab. So I was sitting in the back. So I went ahead and threw on the jump bag suction and the monitor. And we got there, and they had walked in first. I was following behind with a monitor and a C-collar because they said it was a fall. Get into the living room. Mr. Day looks at me and says, we don't need that. And specifically the C-collar. I said, okay. And I go back to put that on a stretcher. He and Miss Megan begin this patient interview. Okay. During the patient interview, I noticed there was a family member there. Family member turned out to be a daughter, late 40s, early 50s. And this older woman decided she was going to stay outside and sit near the porch, kind of near the awning.
The one that fell.
No. The patient, I said, where's the patient? And Travis looked at me and said, oh, he's on the toilet. So I said, okay, I'll go put this stuff away. I said, I'll go put this stuff away. And come to find out, he had walked from the toilet to the kitchen. So from one end, middle of the house, all the way to the other end of the house, by himself, autonomously. I said, okay. And I noticed that the daughter was walking kind of towards that end of the house, and I had walked kind of like near the hallway, and the patient was talking with Travis at this point and Megan in the kitchen. And I had mentioned, because of what I had knew, I'm talking from my experience, I said, you know, man, I want to make sure that we're going to give them care, and I want to make sure that we're making the right choice, because we have, because regional is a community service. So we're here to serve the community, we're here to serve you, and we're going to go see what's going on. And she acknowledged, and she said, okay. And when I get to the kitchen, it's Megan and Travis, and he's sitting on the kitchen chair at this point, facing the living room, and the daughter is right here.
Okay.
And I'm kind of like this on the door jamb, and he's going through a review of systems. He went through, and we did everything from vitals, like primary assessment was done. We had asked him questions, and at this point, the review of systems, asking about some bleeds. We had picked up some PMH regarding July 3rd being prostate surgery, I believe, in some fashion.
Surgical patient.
And also, we had picked up on, he had no chest pain, it was just weakness. We checked for like subdural things, so we did all of the things that we would think would cause this, and then anything that was life-threatening, basically. Travis even palpated his abdomen, looking for potential distension, and we did literally a very thorough job.
Okay.
So I go outside, and I remember grabbing the monitor and asking, and Travis was following behind me at one point. And I don't know if this was before or after that interview, But I remember saying, I said, this gentleman had, the complaint was that he had fallen, but he got a GCS of 15. And I said, with today's traffic on the road, being ALS, it'd be important to perhaps see if they would be able to allow us to help him go down the stairs and have family transport, because we're a community service. And I remember bringing that up to the daughter, and she had acknowledged. And she also said that, well, the reason why I'm not bringing him is because I think that I wouldn't be able to pick him up if anything happened. And it was just 3 steps in the front of the house. And me weighing on my expertise, I said this would be a great opportunity in this case, based off what we know, that we can see to help family. We can facilitate going with family, because we're here. All of us are here. We can just, he can just walk down and brace on us, whatever it may be. And so I was thinking this in my head, and I go back inside me, and Travis acknowledges this. Travis says, "Okay, that's what we'll do. We'll go test out and see." So we go in there, and he starts asking a few questions. I start asking a few questions. And about the time I had said something along the lines of, "Do you think that if we helped you, you would be able to go with family?" And immediately it went from 0 to 100 with the daughter. The daughter immediately went, she said, "If you're not," she said, "get out. If you're not going to transport, get out." And I said, and I didn't, I kept my dialogue in conversational tone. She had exceeded that, and I couldn't get any information or any words out past that.
Let me stop you right there before we go further. Did anything come out of your mouth about abuse of resources, that this call did not need an ambulance, that you needed to, you don't need to abuse the system or use the system for this kind of stuff, or we need to be going to advanced life support type calls? Did anything like that come out of your mouth?
No, I specifically said in the beginning that this is about us facilitating. We can facilitate your help. Okay? With family. Okay. Because this is a green patient. I said, either way you're going, in my mind, either way you're going.
Right.
But the thing is this is a patient who is able to walk. He had a syncopal episode. And in my expertise, everybody that has a syncopal episode doesn't get an ambulance. They can go by family. There's people inside the ER right now that had a syncopal episode. They're vomiting, they have diarrhea, they have fevers. And the list goes on. There's people right there that have been transported by their own family. And I said, because I'm thinking today is Saturday, and on the way here we had a double cardiac arrest, I said this would be a perfect opportunity to give that option out there. Now, before I go farther, like I spoke with Cammie, my objective when I go into the situation is to appreciate that this is something that I walk forward into with my foot on ethics, medical ethics, what's an ethical decision and what's a moral decision. And that is founded around a legal purpose. Okay? Customer service comes second, because customer service can get you in trouble. Customer service sometimes can kind of be I don't want to say troublesome, but you could always be customer-centric, but not have the good morals and ethics behind that.
Okay, but what was your morals and ethics to decide whether the machine was right?
Exactly.
So where are we going there?
Exactly. So with morals and ethics, okay, as I weigh on what my medical director would tell me, or what I weigh on perhaps in GEMS, or any other reference that is about medical ethics. Medical ethics is that I am to make sure that I obtain informed consent. Now, obtaining informed consent, just like any patient, whether it be in a hospital, whether it be in the ambulance, my purpose is to make sure that the patient understands the assessment that I had just given him, that he understands the treatment, that he understands the options and alternatives, just like any patient would. These are patient rights. So I had asked this woman, and to get to that point, I have to ask him what he's comfortable with, and I have to let him know that this is the assessment, and this is what our understanding is based off of our expertise. And when things get abrasive, according to literature, GEMS, American College of Surgeons, even our medical director, even in nursing is the best at this of all, which is patient interaction.
The objective is to portray empathy and education. Now here's where this went south. Okay, as I was trying to portray this and say, ma'am, but she was so hot and belligerent that she just said, get out. She said, if you're not going to take him, then get out. I said, ma'am, I'm trying to portray empathy at this point. This is where the call went south. Huge south turn. Number one, we had an issue with professionalism, and number two, we had an issue with integrity. Specifically this. The integrity was Travis knew that we had a game plan and a plan. Travis and Megan both yelled and said, just get out, and didn't follow through as a team and back me up. Integrity hit on his portion. Also, a huge issue with professionalism, because you're never supposed to turn on your team as an employee. So if all of us are on a call, I'm not to be bickering with you. I'm not to be arguing with you on scene in front of patients.
So do you think maybe he was telling you to get out because it was going south with you and her, and maybe he wanted to get you away from her so he could diffuse the situation? Is that possible that he might have been thinking that way?
It's possible, but here's the thing. His integrity told me, as he understood, we both understood that this is what we're going to do, and I'm leading with moral and ethics. He wasn't able to.
Hang on. I can tell you first though, that is not true with Travis. Travis would have never agreed to tell the patient they could go POV.
Well,
as a company, we do not do that.
Okay, that's fine. So then here's where the problem comes in with the integrity and the professionalism. If he disagreed with that, then he could have easily just said, hold on a second, time out. Goes on with the patient's medications. Every time we give a medication, it's time out. Something's not going right in the ER, it's time out. Something's not right, you disagree, hold on a second, let me chat with you. That's how we handle things as professionals, and we maintain our integrity. If he's going to tell me to lead and he's going to be overseeing things, that's where he steps in and says, okay, hold on, Sebastian. Ma'am, I apologize. That's empathy. Let me go talk to him real quick. I apologize that this happened. Sebastian, let's go just real quick. Let me tell you what my game plan is. Instead of now, we've opened up a can of worms. So those two things right there, integrity and professionalism, that's how it's supposed to be addressed in those circumstances. It should have been a timeout. And instead, it was them yelling. And the thing about it was, what I don't get is we come to a scene where there's going to be chaos. There's going to be a need to have appropriate interpersonal skills. And what I found was I was just navigating some basic dialogue, and I get this switch turned on, and there was no support or integrity. It was immediately, I'm in the wrong, you just need to go and just step outside, instead of, no, we're part of the team. And this is making RPS look bad collectively, instead of saying, ma'am, it's fine, I apologize. And we didn't pull out any cards constructively that was supposed to better that situation. Instead, it was cards to degrade the situation and side on the daughter, who had no authority to be inside that medical decision. She was not a power attorney. She was not a guardian. This gentleman had every right to make his decision, and I'm trying to obtain informed medical consent.
Okay, but did you offer that for them to go POV one time and then they answered you and you left it alone, or did you continue to let them know that they could go POV instead of going by ambulance?
No, I had asked them, why is it that you feel that you can't go? And why is it that you didn't just bring him to the ambulance or the ER? And she said twice. Once in the very beginning, and then twice after I had asked. And she goes, well, because if he had walked down the stairs, I wouldn't be able to pick him up.
Okay.
And I said, ma'am, this is a perfect opportunity for us to help you out. That's why we're here. But at no point did I ever say that he's not going to the ER or anything like that. I specifically told Travis, too, that I would like to get them, to be comfortable, if possible, so that we could help them get into the ambulance or into the car. Not the ambulance, but the car. So the thing about it is it's a perfect opportunity, because he was a green patient. None of our diagnostics, 12-lead, glucose, we checked it all out, even his physical. He was able-bodied. I said, this is a perfect opportunity to exercise an alternative. And it's because it's Saturday, and we're busy. We're very busy. And we're a community service, and we take every single call on an individual basis. Okay? This individual basis, just like if it was a hospital on the weekend, they have divergence. Just in case I went to an MVA, for example, on the weekend, and I seen a critical patient, I would call a helicopter. Well, in this case, I can call the family, and they're willing and able to partake in his care. And she followed us all the way there. So it just kind of put in a situation where, wow, like this is a great time to transport him, you know, and we're here to help you. And I couldn't get all of that out because she had just yelled, and all it took was either Travis and Megan to just like, ma'am, we apologize, we don't want to upset you, but we're just, this is him. They didn't build a rapport. They didn't say, look, this is Sebastian, he's been in the field for X amount of years, he's been board certified, you know, he's just trying to navigate some appropriate transport so that everybody is kind of benefiting here. We're obviously very caring about this patient. These are all things this is all empathy. These are all cards that my references and any reference you look at would say, these are the cards we should have pulled. None of that was pulled by my leadership, which was Travis and Megan. Instead, it was just go walk outside. And it just left the whole scene as if this guy at RPS was the bad guy. And it left the whole scene like this was unprofessional because we just got in a quarrel with our own RPS member. You see what I'm saying? That's the problem. Is that we miss the integrity and the professional piece. So then when I get outside and everyone's kind of coming outside and doing exactly what I knew they were able to do, which was help the gentleman kind of just walk with his hands a little bit down the stairs, doing exactly what we could have done, okay, and help them facilitate. And they could have just went to the ER in their own family, vehicle, had a nurse put them in a wheelchair or cane, whatever it may be, and then sat in the ER. Instead, we get inside the ambulance, and all of a sudden, Travis asked me to sit up front because he doesn't want to aggravate. And these guys their mental state is to go and run. It's like, okay, we just want to defuse the situation. Here's how we're going to handle it. They're not realizing that that's not the way to handle it. Just moving the situation out is opening avenues and doors for the unprofessional piece. And unfortunately, it continued as I was in the ambulance. He wanted me to sit up front. Okay. So I did. And then all of a sudden, Megan feels that she needs to run 1,000 miles an hour. Lights and sirens for a green patient. Okay. She's doing 40, 45, and a 25. Okay. She's going in an intersection that has lanes 1, 2, 3, and 4 at a red light. Okay. Every lane is occupied by vehicles, and she thinks that that this patient requires the necessity to push those vehicles in the intersection. And that's not what we do in TIMS. That's not what we do in EVOC. That's not what we do in EVOC. We don't exceed more than 10 in EVOC.
So we do have a company policy to run lights and sirens to the hospital.
That's fine, and I understand the Alabama policy on that. But this is where we go to morals and ethics. I'm weighing in on moral and ethics, right? Beneficence, malfeasance, all the things that we're to learn on the ethical portion, okay? And how poor ethically and morally this went south, and legally, okay? Because if anyone was in an accident there and you're pushing cars into the intersection with cross traffic, that's a big no-no. You're supposed to go to the left lane, turn your lights off, turn your sirens off, wait for the light to go green, and then you are to go around. The problem is
where do you get that? Because that is not Alabama EVOC. You don't stop at an intersection, turn your lights and sirens off until the light goes green.
Okay, so we're talking about standard of care and the duty.
Where you're getting that from? Like what specifically states?
Because you have a green patient in the back of this ambulance. What necessitates an emergency? It's due diligence, right? This Alabama state would trump RPS if there was an accident. And in Alabama state law, it says you are allowed to, but you have to...
Ask you, how do you know that wasn't an emergency? Was you able to do a CT on the patient?
But you can't do that because then you would be saying...
how do you know it wasn't an emergency?
You can't, but if you were... I see where you're going with that, but...
That is where I'm going with that.
But,
it was 4 days post-op. How do you know he didn't have a bleed?
You don't know that.
Exactly.
But
so how
here's
do you know it's not an
because whenever you're looking at the clinical picture, If this patient
Are you able to diagnose?
I know where you're going with this. The problem is when he hit the ER, was he going in a trauma room?
It doesn't matter. Did we know he was not going to do that?
So why are we running emergent if he's not going in a trauma room?
Because we don't know if it's a real emergency or not.
Is he going to a code medical?
You don't only run lights and sirens.
You don't know that. You don't know that. And the doctor would only
So you don't only run with the company. You don't run just code 1 with somebody that's a trauma alert. Okay. We run code 1 with anybody that we can't diagnose fully.
Correct.
We run code 1 with anybody that was a code 1 and we went to them, and we find that the findings that we got there were legit, and we go back with them. Now, I get what you're saying is green, and I understand that.
Correct.
The problem is the patient was post-op, okay? Could have had anything that you were not able to diagnose because we don't have that kind of diagnostics in the field.
Right.
Now, could you have been totally right? Absolutely. Could they have been totally right? No. But if you had downgraded that, and you had said, no, we're not going to go emergency. We're going to go with traffic.
Yeah, because, okay.
So when you do that, if that guy had thrown a clot or he had done something, it would have been on us and you.
Yeah, of
because
course.
there was an emergency call, there was a 911 call.
Mm-hmm.
Okay? If it had been a guy that tripped, and then you picked him up and said, look, I get he's not feeling good. If y'all want to go to the hospital POV, that's your right.
Mm-hmm.
If you want us to transport, that's perfectly fine too.
Mm-hmm.
And we transport and we let it go.
Yeah.
We just transport.
Right.
And so if Megan did, which I can pull the videotape and I can look at y'all's complete
I hope you do.
transport, and I'll be happy to do that.
Please do.
The fact is that if he called for a transport, a 911 transport, a code 1, then that's the way they go.
Mm-hmm.
Because he can't be for sure that there's not going to be a different outcome.
Mm-hmm.
Okay.
Right. And
so
when
that is our policy, and that
Okay.
doesn't, and Alabama is not going to trump that because due diligence I get is would everybody else do the same thing?
Mm-hmm.
But it doesn't matter because if that is it's paramedic discretion.
Mm-hmm.
Paramedic discretion
Exactly.
states that he felt that this was to get on to the hospital and let's get him looked at. And that way, if something does happen, we did our due diligence and we got him to the hospital.
Correct.
Okay.
And I couldn't facilitate that conversation because I was interrupted.
Okay. So
That's what I'm saying. The daughter is the problem here.
and I got you. I understand that, but here's the thing. I appreciate you wanted to. You were pushing the ethics and you were pushing the morals and you were pushing the community service and all that. I get that.
Mm-hmm.
But we are not in the community paramedicine business.
Mm-hmm.
Okay, meaning that we started a program like that and we ran it and we try to do the best we can with. Hopefully, if they don't need to go, they will listen to us. If they don't need to go, then we can suggest, hey,
He was going.
everything-
He was going.
I get it, but.
That's what I don't get is he was going.
Where did it go south that, and I understand you're saying they didn't back you up, but where did it go south when all of a sudden you're saying, can we help you to the car? And she hears you say,
You're taking him.
You're-
The second you said that right there, no, get out. You're taking him. Get out.
Okay.
That's exactly, literally verbatim. You just said that.
Okay.
I started asking that, and she's like, no, you don't want to take him? Get out. Get out. And instead of them just intervening and saying, hey, look, ma'am, we don't want to upset you, okay? But here's what we did, and based off of our expertise, because it's our discretion. We have 2 paramedics here, okay? I understand that you are very upset. I really do. And I want to make sure that we're giving him the best care. I want to make sure that we explain to you that we've done a thorough assessment. We have checked everything from his heart. We've checked everything from his lungs. This is a lab thing. This might be an anemia thing. This might be an electrolyte thing. There's nothing.
Let me stop you right there 1 second.
Okay.
When you saw this was going south, okay, why didn't y'all just go, yes ma'am, we'll load him up and we'll get him to the hospital?
I left,
Okay.
like she told me to.
So,
And they told me leave, instead of opening up the door and the avenue to
but why
empathy
would-
and
but-
education.
but that would have made things worse.
That's not what all the literature says.
Okay.
When you have a difficult patient, family member, the literature literally says here's the tools on how to tackle that.
Have
You
you
either
ever
approach it
worked-
with empathy.
I got you.
And here's the thing. I'm going to say one last thing, and then you guys can say whatever you want. Where I come from, because this is a thing that happens in inner cities and happens a lot with
Understand that.
Raleigh, Durham, we're talking Charlotte, we're talking, Virginia Beach. This happens a lot. Okay, I'm going to say this one last thing.
Sure.
We are ill prepared because see how we're going. I knew this was going to be like this. The new school, the new kids on the block know that this is an avenue to open up a can of worms when you have someone's family like this. Mm-hmm. The way I practice is if there's a family member, and the way I come from in like Richmond, if there's a family member there and there's a patient there, and I arrive on scene, I know immediately that the game plan with me and my EMT basic or advanced is to make sure that the family member is not near the patient immediately. That is a golden rule. Okay, and that's where we failed as having preliminary understanding of the situation, which was, this is a family member? Okay, she needs to be removed immediately. We need to give her empathy and education and say that we love to, forward everybody morally and ethically a sound judgment and assessment and treatment, and we're just going to make sure that he's okay. And she would agree to that. That's where everything went south. And that's the approach that needs to be taken, so these conversations aren't even had. Because I had it with Cammie, and she said, Cammie said this. Cammie says, well, everybody handles it differently. That's not what you want. You don't want a team of RPS people out there handling things differently, because now you're opening up variety, you're opening up diversity and entropy. And that's not what you want, because that's chaos. Because everybody can just do and say whatever they want. But if you have an education system and an understanding of, okay, if there's a family member here, relatively in a green situation or a yellow situation, that's not too chaotic. I mean, trauma might be a little different, but if we have like a little visit like we just had, and we have this nice, cool, calm, collected situation, you never approach with the family involved. Always try to separate, have the EMT remove them, and have a chat with them. Let the paramedic do what he needs to do, and we would never be going into this whatsoever. That's how we handle it.
Later on you would, though, because unfortunately all the other places you have worked is not like Alabama. From everything you have just said. Because in Alabama, no matter what, the family is going to be involved. It is how it is. And once you remove that family is where that scene is going, automatically it's going to become chaos because that family member is not going to like you remove them. Certain situations, yes, it's okay to remove the family member. But if the daughter had been there since since surgery, then it is her right to sit there and tell you what all is going on.
How so is it right? She's not a power of attorney.
Because we're us as a company is not going to separate the family and make them feel like they are not going to be making decisions.
Well, we could always share this. We can share that decision. We can share that decision with the family. But the patient, by law, by federal law, has a right to make his own decision, informed decision.
I'm not telling you.
And then he can share that. And the laws state that if a family comes in and tries to intercept that, they would never bang heads that hard. But if there was a hard head banging, then technically the family member could be removed by the police for intentional torsional interference.
I'm not saying that, though. Mm-hmm. I'm not telling you to give the family the ultimate decision.
No. But it's the patient's ultimate decision.
We're never going to remove a family member unless it is becoming like that.
Unless the patient is sitting there and saying, she doesn't speak for me. She doesn't speak for me.
Right.
And that patient is saying he's going to go. And the patient says, I'm not going to go. Mm-hmm. And he's of sound mind, and he knows time, date, place, and he knows all that.
Correct.
And of course, we'll go with the patient.
Right.
But if the daughter has been there taking care of her father, whoever that was,
sure,
and she's part of it, then you have to respect what she's saying. If the patient is not disagreeing with what she's saying,
right,
and she is probably the predominant caregiver, and in these type areas, you will absolutely see that. Because this is country, southern, grandpa, pa, I'm the daughter, I'm going to tell you what you need to do and stuff like that.
Right.
Now, nobody is saying if the patient is going, I'm not going, and she don't care for me, and she continues to do it, absolutely you need to do what you need to do. But the fact is, just like Seth said, we're not going to separate families when they're talking for the patient unless the patient says, I don't want to do what that person is telling me.
Mm-hmm. And that's the thing.
There's no point in that. There's no sense in that because she could be given every bit of care to the father and knows what's going on more so.
How do you decipher between what's abuse and what's not? How do we know that she didn't push him or something going on? How do you decide it?
We do not do that.
The only thing we're there to decide is we're there to decide in what condition is that person in.
Mm-hmm.
If you see neglect or you see something like that, it's absolutely our obligation to report it
Right?
to the hospital. But it's the hospital's obligation, unless a police officer is on scene and witnesses it, to go forward with collecting information and advising the police or whoever, VHR, whoever that is. That's not our job.
Mm-hmm.
Our job is to say, we're here to take care of you. What do you want done?
Mm-hmm.
And we see from our findings, this is what we can suggest.
Mm-hmm.
Everything we see is great, or you look great. Everything looks great. We don't see anything that's just kicking us in the face.
Right.
Would you like to take them POV, or would you like to go by ambulance?
Mhm.
As soon as they say, I really feel more comfortable going by ambulance, it's done.
Right.
It's done. It's not the time to make
And
an ethical
I never,
decision and to go, well, here's a great opportunity. For
I've never
us
heard,
to-"
but I didn't hear him say that. That's the
But
thing.
That's not the time to do it.
No, I never heard him say, like, I never heard the patient actually say, like, I want to do this. And that's the thing is, I'm trying to navigate this,
And I
and if
appreciate
she
that.
cuts me off, then it's not the time to say, just leave. It's the time to say, hold on, ma'am. He's just trying to be empathetic and understand the patient. That's just what should have went
Now,
happen.
if she's saying, I don't want him to go, then absolutely I'm gonna look at the patient and go, are you with her on this?
And that's
You don't
where
want
you're
to go?
stuck now, because you have a belligerent patient, a belligerent family member in proximity. And that's what I'm saying is, when you have them in proximity like that, sometimes if they're older and they're senile, they'll just go with it. They'll just go with it.
Okay, you just said,
And-
if they're older and senile, now what if she's not there and you start talking to him and he starts telling you what he wants to tell you,
Mm-hmm.
even though he doesn't know the best cause for him, or he doesn't know what the hell he's talking about?
Because-
How do you get around that?
Because my doctors above me, they have the same conversations with dementia patients, and they wait until the lucid interval is over, and then they gain consent. And that's evidence-based medicine.
So when
That's,
are you gonna do that on scene? How
That-
long are you gonna be on scene to decide he's lucid?
well, all I have to do is just determine what his GCS is. Is it episodic? Is it intermittent? How long does it last? If it's not appropriate now, or within the next 5 to 10 minutes, 20 minutes tops because it's medical, then I need to have somebody make a decision. It's going to likely be me, because I see that he's not oriented to make a decision for himself. So we have to do something. If he has a lucid interval that doesn't exceed a certain amount of time or surpass my time on scene, which is usually 20 minutes for a medical call, then I allow him, if his GCS is 15, to make a medical decision. Just like my superior, my overriding arching doctor tells me he does, based off of literature and how they handle the dementia patients.
So my question is, you walk into the scene and it's not obvious that there's neglect,
Okay.
theoretically.
Okay.
They called you because they wanted to go to the hospital, so obviously they're not trying to hide anything, okay? So secondly, there's no injuries. that
Who's they?
The family,
Okay.
okay?
How many? Just same thing, like one daughter, one patient.
Just
Okay.
who, I'm saying family is just, okay, so daughter, mother, whatever. So now you're there, they obviously called 911, so they want them to go to the hospital. So I think you could probably rule out somebody being mean, somebody neglecting somebody, because they want them to go.
And they're very concerned.
They're very concerned,
Okay.
you're post-operative. So what would be I get what you're saying about literature, and look, I appreciate, you're obviously very knowledgeable. I saw the day that you got here, you were very detail-oriented and stuff like that. But you ever watch Andy Griffith?
Mhm.
Okay.
I'm not gonna go down a character thing. Just
I'm not getting into a character, but I'm like, sometimes we just have to deal with the patient and the family and not necessarily worry about what Jim says and stuff like that. It's not an ethical thing, that's not a character thing. But sometimes when you start trying to go exactly by the findings, the new age, the new this, that a family member may not understand that. A family
Correct.
member may not take that.
exactly.
Is the way. So when you're trying to get somebody to get her away from him, she may be the spokesperson for him.
Yeah.
So
Where's the threshold? You're asking where's the
and
threshold?
it's very tough.
Mhm.
Okay,
And
that's
the-
very tough.
And the threshold is this. You guys are constantly touting that RPS is a service, a customer service, right? A customer service. So with this moving forward with either Travis or Megan or me, and hopefully all RPS employees would take this into consideration, is number one, I noticed that when we're approaching with a solemn, no verbal introductions of each other, no building of rapport. Okay, the new kids on the block, all the literature that I'm reading and bringing to the forefront is about building rapport with family and friends and the patient. Building that rapport by saying, hey, look, this is Subversion, this is Mr. Praytor, this is Ms. Carroway. They've been here for X amount of years. We've taken a lot of patients and this and that. We're happy to be here. We're going to take really good care of him or her. Building the rapport would have helped cushion that daughter's hesitancy and anxiety, and which led to frustration.
Unfortunately.
And we didn't do any of that. We just literally showed up. Travis Reagan literally showed up, stood in front, and just started talking. Didn't say who I was, did nothing, none of that. None of it.
Okay, well,
And the
now,
thing,
I'll give you that. I'll give you that part. We do need to introduce ourselves and we need to get a rapport with somebody. You can't every call go, we're board certified, we're this, we've been in the field for 20 years, we've been doing that. You
Nope.
don't have time for that.
we don't, and this is why the EMT Basic takes the family member and says, ma'am, do you mind if I just ask you some questions about what's going on today? They take them to the side. This is my experience. We take them to the side, EMT Basic, Advanced, whatever, takes the family member and says, hey, what's going on? Tell me about what's going on. She starts writing down stuff. I'm over there with the patient on the monitor. Hey, what's going on? I'm doing my assessment, doing what I have to do. And he's telling me everything. We come back together. Hey, what happened? Me and my EMT Basic. What happened? This, and that. Ma'am, we're just going to go check on it, make sure we have everything right. And then to keep her occupied, okay, ma'am, let me just make sure that this is correct. Let me go back over here with you and just make sure. Then I'm doing what I have to do and finalizing what my decision is.
You know that
Okay,
not
that's
all
choreography.
basics,
Basics, advancing, intermediates, I said.
correct? We have drivers, which are not gonna know the crazy questions that, or know to take a family member off there. We have just drivers who have no medical training at all.
Well, I don't know. I don't know what to say. I mean, if a driver is willing and able to just get basic information or ask questions, are they allowed to go into PHI, like have PHI from the patient? Or is it just a driving
We already talked
exclusive?
about this, me and you, and I've already let you know that they're perfectly, they have the ability to know everything that you know because they are directly involved in that patient.
This
And
is,
I've already gone over this.
So this
What I'm
is-
telling you is they may not know yet.
so
They may
the,
not know what to ask.
You're not going to work
That's
with
right.
the same.
that's right. And so this is why it's called scene choreography. Okay? This is what is in our books. Okay? When you can become paramedics, it's called scene choreography. This is why the NREMT says, here's the trauma sheet, here's the medical sheet. We're going to do this during the primary, we're going to do this. So what I do with the driver, I say, ma'am, just do me a favor and just do me a sample real quick in an OPQRST and just see what's going on, see what they
What if
say.
that driver says what's sample?
Then you just explain it to them.
We don't have time to do that on scene.
We don't explain it on scene. This is part of the preliminary. What are we going to do with this? This is a call for X, Y, and Z, a fall. This is a call for X, Y, and Z, a nausea, and a stomach ache. On the way there, I just need you to fill out a sample and an
But
OPQRST.
here, not all falls are falls. Not all nausea, vomiting, or nausea, vomiting. Every call is not how dispatch gives it to you.
That's correct. But a sample is going to have the same standardized questions.
Okay,
for
let me-
everything.
Let me just ask you the
For-
bottom
for
line.
every single
I'll just
thing.
ask you the bottom line. The normal way we do it, we are going to find out. We don't do all the separating, we don't do all the investigatory stuff that you're wanting to do with taking somebody aside and getting this story, and then getting this story, and then coming together and making sure their stories fit and all that kind of stuff.
Well, you said the family would know more. That's why we do
And I
this.
get that, so why can't you just talk to them together? If you don't feel like there's any malfeasance, which
Oh,
was your word,
because-
if you don't feel like there's any malfeasance, which was your word,
Mhm.
why do we have to separate everybody and get two stories, and then you two have to come back together, and you have to do all that?
Good question.
Why is that necessary?
Because whenever you are a caregiver and you have someone around that's persistent, especially a family member, my experience says I have family members that could be hiding medications. I could have family members that have been given medications incorrectly. There might be medications that led to noncompliance, and I might have family feud, which is extremely common. Okay, I might have some aggravation based off of my time with that caregiver. Okay, and when I have someone talking over me, asking questions, and they're both side by side, sometimes the patient is going to be less likely to answer truthfully when the pressure is exerted by the caregiver, or vice versa. And sometimes the caregiver will just snap and say things like, oh, he's supposed to be doing this, but he's not. And it just becomes like sometimes a family abrasion,
So how about our
and
remedy for
that messes up the interview.
So let me give you the remedy. The remedy for it is, you know, we've been called to transport the patient. So we transport the patient, you get the patient in the back, and the person drives up in front because they're not allowed to ride back in the back with you. And then you talk to the patient and go out to the hospital, and that way you gather more information. And you're able to tell the doctor what the situation is instead of doing all that nonsense on the scene. Now, I appreciate...
I mean, it was going to be 20 minutes either way.
I appreciate what you're saying,
Mhm.
okay? And I appreciate that you're schooling me on all these big terms and everything, but I've been a medic now for 29 years, and I appreciate what you're saying. And not that I'm a pair of God or anything.
This is not me. This is like where
I appreciate
other,
what you're saying.
Yeah,
Okay, I appreciate that. But my bottom line is, and what Seth wants to know and what HR wants to know is, are you able to go into a call and somebody says, I want my dad transported because he is post-op and I want him transported. And the father does not disagree with that.
I didn't know
And
that.
can you know, I'm saying, the father is not there going, please don't make me go because she's a nut and she's hurting me and all that kind of stuff, okay?
Yeah.
So you got on the scene, they care for the patient, why can't we just take him to the hospital?
I never knew what he wanted. That was the purpose of me talking to him.
Okay, so...
By law, I have to have informed. This is exactly what
You know
happened.
where informed consent comes from, though? Hey, do you mind getting up and getting on that stretcher? If he gets up and does it, that's informed consent.
Yeah, but I also am, by law, I'm supposed to give him my assessment, help him understand what's going on. I'm supposed to actually give him alternative if he wants one, and I'm supposed
Don't give
to...
alternative. By law, you do not have to
Well,
give an
that's
alternative.
what my physicians do. If you're saying here
When
you don't want
say
to do
your
that...
Physician, okay,
Yes.
here's my bottom line.
This is, you can look at, I know what you guys
Listen,
are trying to understand.
Listen,
I'm listening.
here's my bottom line.
Okay.
Because I don't do literature and your physicians and your experience
Really?
unless you've worked in Alabama.
Let's talk to the medical director. We'll have the same discussion.
Our medical director also knows every protocol and policy we have.
That's not what I'm talking about. We're talking about medical ethics and morality. And he should shed light on everybody and clarify what he wants. And then we can all understand.
Are you going to do it the RPS way or are you not? Because if you are not willing to follow our policies and the way we do things, then you're not going to be a good fit here.
Yeah, I agree. And you know what? I want to make sure that we're very clear after this discussion, is there's a lot of things called RPS-isms here. And the unfortunate piece is that I'm finding that it is not on paper. It is not for me to go back and look at or reference, because after 6 months, everybody's brain gets shuffled and scrambled. And this is why we have continuing education. Okay, so when it comes to you wanting something from me, okay, I have to have a standard formally in writing or something tangible that I can always fall back onto, so that we don't have these discussions again, so that I can share what's appropriate to my other team members, and so that I don't jeopardize the customer service component, which is what
doesn't give you enough direction that would have
Or Alabama protocol.
or Alabama protocols doesn't give you enough direction.
you're saying the discretion of the EMT paramedic. Okay, I didn't know what his consent was. I didn't get to that point.
Okay.
The reason why we're here is because we had an issue with the integrity and the professionalism by my team members, which was not
What
maintained.
integrity there? You keep going with integrity. What I get the professionalism, we think, but what integrity do you think? Integrity to me is we want the money, so we're not really don't give a shit whether he needs to go or not.
No.
We want the money. Where are you going with integrity?
No, the integrity is him and I had a game plan, a discussion on what we're going to do, what we're going to follow through with. Same thing as everyone touts that RPS and many, many, many services draw from the military, right? Your squad leader tells you, hey, this is what we're going to do, gentlemen. We're going to go in here and we're going to do these things algorithmically. Let's say it was like the Navy SEALs or like Green Berets or Delta or something. Your leader is going to tell you, hey, look, this is what we're going to do. Here's how we're going to follow through in this particular little exercise or routine. If all of a sudden someone just dips out and runs, does that leader have integrity? And he says that your fault, that you had some type of fault or some type of error, it's not going our way, and he just completely just doesn't say anything, and instead does the exact opposite, and just say, sit down, you know. That's the integrity of the leader that we're talking about here. That's the integrity of Travis was the guy that was here at RPS and knows the RPS isms. Okay, he didn't tell me that, okay, let's just do a timeout. Here's what I'm going to do as Travis. I know maybe you're trying to do this. And that's all we had to do. And then we could have came in there and coalesced and completely like just snowballed her with empathy and education. And if she didn't want education, Travis could have been like, look, I don't even want you to say anything. I just want you to apologize. Go in there and apologize. Say, ma'am, I didn't understand what Travis wanted. That's all. And we're going to go ahead and just help facilitate transport. That simple. That's what could have went down.
So
and
there's no doubt that communication could have been much better the whole way around.
That's how my
Nobody's
leaders.
arguing about that. okay? Because I don't know. I haven't heard everybody in here, and I haven't met with everybody, or he hasn't met with everybody. So communication could have been a flaw. Communication is a problem with any company over 5 people, okay? So I get that.
But
things could have been, hey, stand by.
Okay.
I get things that could have been better, okay? Not going to argue with that. My question going forward, and Seth's question going forward is, are you able to go in there and check out a patient and say, yep, we need to transport it. Let's transport it. Or are we going to make every transport of a patient a knockdown legal battle about, did I do this, did this? Well, my person did this. Well, Jim says I have to do this. Well, this says I have to do this.
Okay.
Because it amazes me how we do 207 calls a day for 30 years. And we do a pretty decent job. So I appreciate where you say isms and all this kind of stuff, but I don't appreciate where you're here for a week and you're kind of telling me everything that we do wrong when we're 640 strong, two helicopters, and 30 years behind us, and in a week you have ascertained every problem that we have in this country. And I don't think that's right.
Okay.
Now, if you don't think we're doing the job correctly, and you think that there's another company here in Alabama that might fit you better, I completely understand that. And there's no malice in my words or personality.
It is about a win-win and a fit.
And I would say the same thing with Travis and Travis and Megan. I would say the same thing. So I'm not trying to separate you. Okay. My question is, where does this go from here? Because if your direction now is going to be to figure out everything that's wrong with RPS and to find out what you consider is our isms and what we're doing wrong.
Hold on, let me clarify
and all that
something.
kind of stuff. Where do we go from here?
Let me clarify something. I was told that you guys have an isms, meaning like this is what we do. This is what we do. That's what I was told.
Any
So-
company's going to have that.
So,
Shoals, North Star, Lifeguard, AMR, any of those guys are going to have the way they do it. As long as we don't subtract from the state of Alabama laws, we can add to them.
I didn't know.
We can do anything.
I didn't know you're allowed to run
So-
over 20 miles an hour.
So what I'm saying
And,
is, and we're not supposed to, and I can definitely look back on the tape and I can figure that out, and I will definitely talk with her, or Seth will talk
And
to
please
her
get
about what's
back,
happening.
because I don't want to ride with someone like that.
We will not tell you.
No, I'm not gonna tell
We can't
you
tell
what we're
if
gonna
we
do.
Okay, well, I'll call you directly next time. I will call you
That's
directly,
perfectly fine.
because that's what I should have done.
And I think in the orientation, I told you that if anybody does anything that you feel is unsafe or anything like that, to call me at any given time. But I gotta be honest with you, a lot of what was being said, I don't think you were paying attention. Because a lot of stuff, your eyes were closed and stuff like that, because I was behind you and I was watching,
Where?
okay, in orientation.
Okay. I don't remember.
And then, secondly, I knew that it was going to be a little bit because you made the comment, I hope this inadequate information is not something that your company continues to see, that I will continue to see.
It was, okay, I remember
And
now.
so I knew that there was already a little bit of twinge right there because I saw the attitude already. That, well, I hope the information inadequacies that I am.
It was, I know what you're talking about. It was with Miss Calloway, because I had spent over 2 weeks trying to get a hold of her. And then, she was pressuring me to do the drug test, and I had to stop, and I was the one holding up the drug test, and I was in the middle of sending that. And I had already offered to send all of my information, and I've been getting correspondence for over 2 weeks trying to get a hold of her.
And I can appreciate
And
that.
I was like, ma'am, I wish that you could see the amount of correspondence and how I've been trying to contact you. And I was like, I hope that this is not the path that the rest of administration is on, which is all of this delayed stuff and this cat and mouse thing, because I had tried email, I had tried all of these things, and now I feel like I was being punked because I was holding up the class. I felt disrespected and embarrassed. I was being embarrassed.
You were never disrespecting.
I felt
was
embarrassed.
sitting behind you and I knew exactly what was going on.
I felt very embarrassed.
Disrespectful that you slept the whole time that I did my presentation.
I slept?
Yes.
Because she was
I
watching.
didn't close
your
my
eyes,
eyes.
and
Yes.
Yes, you did. Yes, you did. Because I got up one time when she nodded to me, and I got up one time and your
I
eyes
slept?
were closed. You were like this.
Either you were.
I think I was
sleeping, your
looking-
eyes
You
were
were-
completely
I was
closed, or
looking
you were
down.
disgusted with me.
I think I was looking down. No, I was reading looking down. I don't sleep on
Here's
people.
the thing, number one.
I don't
she was
sleep on
never
people.
at any
I was
time-
looking down. That's what I was doing. I was probably looking down like this. I don't sleep
But
on
I do
people.
have proof that your emails were sent and it was done just as everybody else that was in the room.
I wish I had that correspondence.
But listen, here's the other thing you have to understand, and I'm not making, we're a big company and we have to fend for ourselves, but we just started this every Monday orientation. Okay. Normally we have one orientation a month. Okay. So the powers that be in this company decided we're going to do one every Monday. It really took a toll on trying to get everything figured out, trying to get all the paperwork done, trying to get all the background checks, trying to get all the MVRs and all that kind of stuff, which they're having to do. That's why I've actually moved over to HR, is to help them, because now we're doing a month instead of 1 month. So you came into the brand new of that. Might have looked a little rough, might have looked a little tough, maybe you had some discrepancies that we thought was happening, didn't happen. I understand that.
I called her peers just to get a hold of her, and they didn't give me any correspondence, nothing. So I was like, "There's no way that this is how you guys function. I mean, it's not how we function anywhere else." So I was
Whatever
confused.
happened, I'm not sure. So I'm not going to debate it, because I get it. If you had frustrations, you had frustrations, and I can't go back and fix that, nor can she. The fact remains is, I don't know the actual fault of that there was a fault. It may have just been, we need to talk a little bit more about rapport. We need to talk a little bit more about customer evaluation services and that sort of thing, and that's fine. But the fact is are you going to be able to go forward with this company and do things more as we're asking you to do them, or without asking you to do something that is not policy, that is not Alabama state, state ethical or whatever else you want to go to?
Okay.
Are you able to do that, or do you feel that we just do things too haphazardly and maybe not to somebody else? And
Right.
I'm asking that, and there's no malice from any of them.
Agree.
Nor is there any attack or anything like that.
Okay.
But you're going to run into that to any service here. That is why we just put in 10 of Shoals' people to our roster now, which is because they are jumping ship with Shoals.
Everyone's
because they're
jumping
not-
Everybody's jumping ship in
That's
EMS.
right.
It's a revolving
So
door.
It's a revolving door.
It
And
is.
as soon as somebody leaves us, they go over there and they're hired in 10 minutes. You know how this works. But we're getting an influx in them jumping ship because there's a lot going on with Shoals right now. Will that happen? Absolutely. Will they go back? Probably more than likely. But the fact is, you're going to run into that. Okay. So if you're not able to do this, and if this is not something that you feel comfortable with, I completely understand that.
Okay.
But we will go and we will touch base with the family, and as long as we don't see that there's any problems or any issues or anything like that, then we will listen to what the family has to say. We will listen to what the patient has to say. If they want to transport it, we'll transport it.
This type of conversation and dialogue needed to be done sooner. When you're saying this is what you're expecting of me, this needs to be an orientation. This needs to be the way you're telling me this is how we work here. This could have been. What I'm saying is, I feel like there's an education piece that's missing. That's missing from the orientation. Okay, because you have these expectations, and if you're taking someone like me that's coming from progressive systems, and like let's take for example the organization I work with. My medical director was co-author of AHA. So
So you're coming from a progressive, and we're antiquated. Is that where?
That's not what I said. What I'm saying is these doctors that I've worked with. Not to say that these guys here are any less or any more. What I'm saying is they're very I want to say literature based. They're evidence based. Okay, that means that whenever I approach a new facility, if I have been in that particular facility, in that team for a specific amount of time, and I move to another team, I'm looking for the same or similar type of education or guidance or something that is befitting to how you operate. I didn't get that here.
What are we asking you to do that you wouldn't do with somebody else? So we're asking you not to separate the family.
Yes.
We're asking for you not to get your partner to get a story.
Yes.
For you to get your story, and for y'all then to come together and make sure your stories are together, and then you can go back to the patient and say, okay, we've
It doesn't
conversed, and we've decided that your story and her story are both plausible.
It doesn't sound right.
do.
It doesn't sound right.
It doesn't sound right, but that's what you're saying.
But that's what they do.
Exactly what you're saying.
Exactly. And
Okay, we don't do that.
that's fine.
Okay?
That's fine.
And I didn't know I didn't have to tell you that.
Okay.
Because we do orientations, a million of them.
I never knew anything about your lights and sirens. I never knew that you were allowed to do it on every single call, even if it was a green patient. We ran lights and sirens on every single patient, regardless of if their status was to deteriorate, regardless of the patient that I took. It was a red patient, according to triage. We took green patients, lights and sirens. We were doing over 20. I mean, and it all says the due diligence in Alabama state law. If that's what, and if you're blowing over 20, doing 30 over, doing 45 and a 25, if that's what you guys do, and you're asking me not to say anything, and this is just how it is, and be told by Haggerty, be told by all these people, I need to have on paper an understanding of what it is that you guys do and how you guys
Do
run.
you think that we're asking you to do that?
No.
I think in
I don't think so.
5 minutes I said in orientation that we are very safety oriented, and if you see anything that is being done unsafe or something that you don't feel comfortable with, what did I say today?
I wouldn't be able to appreciate that unless I was sitting up front. So I'm glad I sat up front. That
But
was
you
the
know
one
that
day.
She was going 20 miles an hour to the speed limit, and you said it concerned you very greatly.
It
you
did.
give me a call?
I did not. Because
Because
this was because she told me that we're to go outside, and I'm in a situation where they don't want me to talk. They want to put me in this suppressed position. So this is how she does it.
there is nothing you're going to tell me right now that gives me an excuse as to why you didn't call me.
Okay.
You know the state law.
I
What's
do.
the state law?
I do. The state law says that you're allowed to run.
10 miles
That's not the state
over
law.
the speed limit.
That's EVOC.
That is EVOC, but that is still Alabama state law
Mm-hmm.
says 10 miles over the speed limit for a responder.
Correct.
So you just said that's not state law. That is state law.
No. So state law is basically you're allowed to use your due diligence to run red lights and exceed to any capacity. But EVOC specifically, and that's Alabama, like literally the code is, matter of fact, I think I have it right here. And then EVOC is the 10 miles an hour. But Alabama there is no speed limit. There is no speed limit in Alabama. I looked it up yesterday because I knew we were going to have this discussion. EVOC specifically is 10 miles per hour over. The reason I didn't say anything was because I felt like I felt so disrespected almost because I was trying to find informed consent. That I was just like, anything that I say, honestly, I don't even know what to do. And then the fact that she blew through the intersection too is just like, because it even says in Alabama law, you're supposed to do these things.
You're supposed to clear all lanes.
I had my hands up because I was like, wow, you guys are tying my hands because I'm trying to find informed consent. I'm getting blown up by the family member, and then I'm having
Let me ask you a question. What informed consent that you did not? What did you want the man to do? To say, I physically want you to take me to the hospital. I am aware of what you were doing. I am aware of what you were saying. I'm aware of what you're going to do to me in the back of the truck, and I'm aware of where I'm going. Is that what you seriously?
So that's not what informed consent is about. Informed consent is saying, okay, I showed up like a Mr. Praytor. I understand today you called 911 or your daughter did because you had fell a little while ago. And got some bumps and bruises, but we checked you out. You don't have anything that we consider life-threatening at this time. We did some diagnostics and we ran some blood sugars, and you're able to answer our questions. Based on our assessment, we see lots of patients, Mr. Praytor, and our physical. We would like to just share some options with you because we don't feel like you're going to deteriorate or have any type of emergency between now and the time you go to the hospital. We do want you to go to the hospital, and we were considering that perhaps because of our assessment and our expertise, that maybe you would consider going with family, and we can help you go with family down the stairs, and then we can help you go to the ER in that fashion.
So you're going to do that route.
If not, then we could definitely take you, Mr. Praytor.
If you're going to do that route, you also have to tell the patient we're going to bill them. Because if you go out and you do all those diagnostics, we're a private company.
Yeah.
There's
We're going to
a
bill
fire
the patient.
department that comes out of.
We're not city funded, we're not government funded, we are private paid.
And maybe, you know what, maybe that's my, I don't want to say a problem, but maybe that's what my background has so much diversity that I'm appreciating so many different policies and procedures that because I have so much diversity, I'm coming to you and you have a different way of doing it. And so I might be used to the past of maybe 2 out of the 5 companies doing it that way. And that's what I'm saying is someone like me with diversity, perhaps I do need to have something in writing that I can relate to so that we don't run into these problems. Do you guys want to treat patients with families in this fashion? That's what you do. I mean, you guys have it.
Have you looked at our policy, though?
Services policy.
I've asked multiple times on TraumaSoft, where is your policy book? Where is your policy book? I've asked Haggerty, I've asked Travis,
Okay, have
and
you
none
called
of
me?
them. And none of them.
Or me.
Have you called me or have you called your name?
I asked. I don't know. I don't know. But I've asked plenty of
You
people.
didn't ask me.
But I should have asked plenty of people.
I can tell you where our policy book is.
They don't give it to me. Why would they not give it to me?
We're not going to print off a whole policy book and give it to you. It's accessible
But we can
on
give
any
it to you on
computer.
thumb drive.
But it should be on TraumaSoft for everybody to understand, right?
That's correct.
Because why would you just give thumb drives to everybody or paper to everybody? This is the same thing here.
I'm
Just like
saying,
when I
if you
took.
wanted it that way, we can give it to you.
When I talked to Mr. Moore, I asked him about it. Nathan. I said, Nathan, he was educating me on this piece. I said, do you guys have other policies, procedures? He said, no, this is all we have. He gave me this.
Nathan told you that was the only policy this company had.
I said, no, not the only policy. He told me that this was the only thing that he wanted that we were going to talk about. I said, you guys have any other policy on TraumaSoft or anything?
Nathan's not going to talk to you about all those. He's
But it says, you know what his badge says? It says education.
correct, but Nathan's not going to go through all the policies. with
He's
you.
not, but he should direct me, right? I should have access to.
So you asked him where the policy book was
I did.
and how to access it. He did
And what
not.
did he
And I didn't, and I can't remember him sharing anything other than
So
this.
if I
And I
call him
asked
on
multiple
speaker,
times.
He's going to say he didn't tell you where the policy book was.
I have no clue.
Nathan is real big on that.
Yeah. And I said, is it on TraumaSoft? He said, no, this is it.
So our policy book isn't on TraumaSoft yet, but it is accessible.
But I don't even want to get into that. I just want to know if I'm have diversity like this, and I'm not coming from just the local guys around here, then I think we should have this type of information.
I don't think we could make enough policies to make, and I don't say this to be mean. I don't know if we could make enough policies that would make you happy.
Oh, you don't think understanding?
I'm not seeing that to make a policy that says when we get on the scene,
Uh-huh.
this is what you're gonna do. We're gonna separate this person, or we're gonna do this, or we're gonna do that. We just don't really have that.
That's what I'm saying. No, I'm not saying that. I'm saying that you guys are functioning with lights and sirens. There needs to be something about lights and
There
sirens.
is.
There is, there's
There
a
is
one
a
policy.
about that.
Where is that?
It's in the policy book, and why
Where is the
somebody
book?
did not give you that, I do not know.
Okay. There's probably other things in there that would probably prevent me from questioning things. You see.
Okay,
So why is it so difficult? I've asked multiple times.
Let me ask you this, why is it, you're wanting to save that, but why is it so difficult for you to come to me, or walk in Carla's office, or Amanda's office,
my-
and pick up the phone and call Praytor?
Because my on-duty.
All of these people that have talked to you, you have not asked a single one of them, you've asked people out in the field.
Because the FTO should have an understanding, which is Haggerty. I spent the entire first day, literally from sunrise to sunset. I mean, I was exhausted. We were both exhausted from just nonstop talking. From when I got there on day one, that's all we did was talk about everything, me and Haggerty. And then I do recall asking, I think it was Diane or somebody. But the thing about it is it's only my second day. And to ride with Travis and
When was you with Haggard? When he was 111?
he was, I don't know. I
On
can't recall.
Wednesday?
It was, I think so. Yeah, I think it was. But what I'm getting at is
Okay.
there's little things that I've just never seen before,
Here's the
and I just
problem
need to be
also.
able to appreciate it. Because if I'm a book guy and I'm looking, then I would appreciate that. Like I would appreciate understanding, what your expectation is.
Your day one was not a day one. Your day one was with Travis. Because Praytor called you Wednesday and told you to be here at 6 o'clock and get on the truck with Travis. And when you got here, you told him no, you had to meet with Nathan. They called me that morning
Yes,
and told me that.
that's
And
correct.
Praytor had already told you to get on the truck and we'd pull you back and meet with Praytor later.
Yeah, there's a correspondence. So Mr. Praytor had wanted me to go initially with Ashford in Ashworth. He then texted me to go to Jasper.
That's correct.
Okay. Where we had the off-shift deal with Travis to Nathan was because I wanted you to do the verification skills sheet. And you said, oh, okay, he'll be here in the morning.
I said he will be here sometime that morning.
So
We'll get with you at some point in time.
And Travis
Oh,
ran.
by text, excuse me.
Travis was already, he had left before I was even there. And I guess Travis runs additional shifts at fire or something like that, or something. So he was behind late, and he left me. And he stayed out there until later in the afternoon and ran. I told him that I wasn't even skills verified or anything, and that we might need to talk with Nathan before I do any ride time with you, because I wasn't told otherwise. That I should speak with Nathan and have everything filled out, and he acknowledged that and said, oh, okay, I'm going to have you go talk to Nathan.
Did Praytor not tell you to come in that Wednesday morning at 6 a.m.
I did.
on the truck with Travis?
I did, and he wasn't there.
Travis got here before 6 a.m. like he was supposed to. Travis was here.
Yeah, Travis had ran for a couple hours, I think. He was absent. Yeah, he ran over. You have to check the clock. He ran over, and Lynch was there. So Lynch.
He might have ran over at the fire department, but he was here at some point.
Yeah, of course, later in the morning. And so we picked up.
So you started running when you got here.
I was supposed to jump on with him, but at that point, I was intercepted by Nathan. And so I spent that morning with Nathan. And he ran so much that we had missed each other whenever he came in. But he actually ran over, and Lynch oriented me on a bunch of stuff that morning. And I had went over to Nathan, and Travis had missed our connection because I was with Nathan.
Yeah. I've got the orientation. They have been sitting there for, I don't know how long. All right, and I know y'all need to keep talking.
I mean, I'm good. It just depends on what all y'all want.
I guess moving forward, he can, before we leave, he can show you access to the book. Okay, and look, I'm not saying this out of turn. If you don't feel like we're doing things progressively enough for you,
it's just different. It's different,
and that's okay. But if we're not doing things progressively enough for you, I don't want this to be an ongoing, I need to school y'all on how other people do it. Okay?
This is about me
So it's
understanding.
either integrate with us, or it might be better for another ambulance service.
Okay.
And I don't say that lightly,
I get you.
because we don't want you to leave. We don't want things to go bad or anything like that. But either integrate with what we're doing and how we're doing it, but if it's not progressive enough for you or enlightened enough for you as to other people you said you've worked with and stuff like that.
Okay.
And I'm not saying that meanly.
I need to understand you.
I'm just
I need to understand you.
Either we get to an understanding, or maybe it's better if you find another place to understand.
Okay.
Or that is cohesive for you. Okay? And that's all it's about.
Right.
It's about us being happy with you and you being
Happy
happy
with
with
us.
us, and we have a symbiotic relationship.
That's correct.
And that's all it's about. But if we can't have that coming back toward us, then let's part ways so things don't go bad.
Education. I need education.
Okay?
If I'm not getting the education,
we will
then
get people to talk to you, but normally we don't have to go this far. And I'm not saying that meanly. It's
Right.
just, we do 50, 60, 70 orientations, and I gotta be honest with you, you're the first person. I don't know if you're just enlightened more than the other 400, 500 people we have. I don't know, but I don't usually have this problem about where we're not doing this right, we're not doing that right, we're not doing this right. Completely understand about the driving. I will absolutely pull that.
Okay.
If there was something that merits me or Seth talking to her, absolutely we're going to do it.
We're not going to do, that is my biggest issue. We are not going to talk people into it. They call us for a reason. Now,
that's
if you
new
get
to me.
there-
That's new to me.
If you get there and they say, no, I don't want to go by ambulance, by all means. If you don't want to go by ambulance, you don't want to go by ambulance.
Oh, this was not about. Okay.
If
Okay.
we do anything on scene, whether it's hook them up to the monitor, check a blood sugar, it's a service is rendered. We're a private company and we will bill them.
So you're saying if you start ALS on scene
Not just that.
or be a, so what are you saying? Because there's people, the regulars, sometimes they want an asthma treatment, but they don't want to
No.
go. So
We
you
don't do that.
See, this is why we need to have this conversation. This is why we need to have an understanding that there should be some, because when you're in inner cities, this is the type of treatments that these ambulance services and
Alabama
fire.
doesn't do that.
I don't know that. And where have you shown me that you do or don't do these things? Where?
We
What?
don't treat on scene and release.
See?
That's
Where-
an Alabama thing. That's not a us thing.
Where is it in Brems? I just tested in Brems. Just tested. May 6th was mine.
Tested what?
In Brems. That's the Alabama Department of Health. And you're referencing that.
Tested what? Is what
The
I'm asking
protocols. The protocols, right? This is what we're referencing regarding the treatment on scene. And then just because I rendered an albuterol or I did like a little snapshot, I can allow the patient to continue their life and I don't have to transport. You're saying you don't do that here.
We don't do that.
Exactly. And
We're not a paramedic. We are.
Exactly. And what I'm saying is there's a lot of places that allow that. And because I don't understand how you guys operate because you haven't given me the knowledge to do
You
so,
haven't asked me for the knowledge. That is my issue.
I wouldn't know that until I get into the field, and that's why we're here. So now I brought it to your attention. This is why we have the meeting. And so now I'm saying is I am deficient.
I can
on
get
information.
Amanda to give you the policy book.
No, I'm gonna give him a policy book,
I mean,
so I
I
know
will
he
give
got
you
it
the
in
policy
his
book.
hand.
But that is our issue is, you say you've asked everybody, but you have not asked me, you have not asked HR. Praytor tells every single person that comes to orientation, which also drives me insane, that they can call him at any time of day, night, 2
Maybe
a.m.
it's because
He don't care. And he will answer their questions. It is very, very rare that Praytor ever don't answer somebody's phone call.
Maybe because Travis is not an FTO.
Travis is an FTO, so I don't know.
He didn't tell me that. He doesn't have an FTO badge. I would never know that.
It doesn't matter if it's an FTO badge or not. I would not put you with somebody that is not an FTO.
So I don't know what to say. I'm just taking in information. What I'm saying.
I don't think you're going to like our people. I mean, if you want to have a chance, you can. I am full of chances. We are full of chances at RPS.
You're telling me that
But
you're
I'm
doing
not
things
going to
different.
have another one of these meetings.
Okay.
Where I won't let you work until you come meet with me.
Mhm.
So if you can't do the things we're asking, I don't know what to do.
You're asking me to do things that I don't know that you do. That's what
That
you're
is
trying
why
to.
you're with an FTO.
He's not telling me things. He's just saying. He's not saying anything. He's just sitting there. And then I see it, and it's just like, wait, you guys do that here?
I was called that morning and said that you would barely even talk to him. That's why I got Praytor to call you.
Barely even talk to who?
Anybody that was here, the supervisor said they had asked you questions. Travis had asked you questions.
Do you have evidence of that?
They wouldn't
Because
call me on
I
the
spoke-
weekend to tell me that they don't know you.
I spoke to Haggerty all day. Did you talk to Haggerty?
I'm not talking about the day you was here Wednesday. I'm talking about Saturday.
Saturday, we just sat there and it was me and Megan, and then we jumped on the truck with Travis. There was no one to talk to. It was literally Megan sleeping inside a cold room on a couch. Then we did the checkoff and we were literally gone. There was no one to talk to. I'm not sure where you're getting this information from. Same thing with like this whole Nathan
Here or
thing.
there.
It's the same thing with Travis and Nathan and that Wednesday you're talking about. I'm not sure how you got mixed up on that either, because I explained that too, and you felt that you were mixed up on that, and I was intercepted by Nathan.
I was called that morning and said that you told them you had to meet with Nathan before you got on the truck.
Yeah, and I ended up, and Travis was out. So I'm not sure where the communication's coming from. I have no clue. But I do appreciate you saying, hey, there's some paperwork, some policy information that we want you to read. I would appreciate that a lot, because I think that's going to clarify and help me understand what my training officers are doing ahead of time. So I'm not kind of like questioning things or kind of thinking about things. I just kind of understand it. I think that's where integrating is important, where you have to have some information in order to assimilate, or in this case, integrate. But without information, I can't sit here and just be like, oh, well, I'm supposed to do this, or I'm not supposed to question that because this is how you guys do it, and then have all these questions. It's just like, I'm not getting the information. So
do you want the policy book and you want to go home and read it and decide what you want to do?
how about I just read the policy book part of orientation, because I haven't finished I haven't even
There
done
was
but one
45
shift.
pages on the paperwork thing that you signed, which was the orientation part of it. Did you read those 45 pages before you signed your name at the bottom?
The pay core, you have to
Yes.
show me that.
Okay, you
to,
signed
to
it.
double check what you're talking about
You
there.
signed, there was 45 pages and you read, you electronically signed your name at the bottom.
I need to see that.
Okay.
Because I've only had one shift, by the way, so I can't understand everything in one shift, and it requires at least 3. So I need to obviously read and see what you guys do and appreciate what you guys have to offer. But I have asked and done my due diligence regarding how it is you guys do certain policies and procedures, and I haven't been given any information about that. I remember specifically talking to Nathan Moore about this sheet. He said, "Hey, you guys have that?" And it even says right here, 1901. I was like, "Hey, man, you guys got any other stuff like that you're gonna give me?" He's like, "No, this is it." I think that's the first time I've ever went to an EMS system that.
And it's really hard for me. I'm fixing to go to my office and call Nick and
Yeah.
talk to him.
Please.
It is really, unless he was specifically talking about QA/QR or paperwork or getting your license or whatever.
Yeah.
It is very hard for me to believe that Nathan, out of all people that works at this company,
I felt the same because I knew he
told
was.
you that there was no more policy.
I felt the same because his title said education director, right?
Nathan can almost quote every policy we have.
Mm-hmm. Yeah.
So I don't know that that is what he was talking about. Maybe
he thought something else. I don't know.
Maybe he misunderstood you or what, but there is no way Nathan told you we didn't have any more policies.
Okay. Well, there's clear misunderstanding, and we can remedy that.
So, you want the policy book, or you
Yeah.
gonna work shifts?
Yeah, let's check out the policy. But remember, I'm part-time though, I'm not full-time.
Okay. Well, in order to stay part-time, you do have to have your ride-alongs done in a certain amount of time, right?
Okay. I wasn't
And
even.
that's not necessarily a company policy, that is a me policy. I'm
Okay.
not-
I wasn't even told that. I was just told by her that I had to do. Matter of fact, it's in the email. She said usually 3 12-hour shifts.
But that's me telling you now. If you take this policy book, I'll let you read it or whatever you want to do. But you have to have all your training done within a certain time for me.
Okay.
Not necessarily RPS, but I'm not going to continue to leave you on our roster
Okay.
if you haven't got at least your training in.
Yeah. So what would that timeline be?
Normally I give new hires 2 weeks unless they give me a really good reason why they can't.
Okay. Well, it's been was it Wednesday last week? So we're almost going on 4 days of that window. I think 4 or 5 days now. 4 days of the window. I don't really know, but we can look over that, and I don't mind it.
So that is our ultimate question. Is that what you want to do?
Yes.
You want the policy book and you want to continue working here?
I do. And the thing about it is I want to make sure that as a team, because ultimately I'm going to leave this room, I'm going to leave this conference, and I'm going to go back to a team. Okay? I want to have an understanding that as a team, that we're thinking about these things according to, in this case, from the learning point, of what we're going to do and how we're going to address these things with each other. Okay, if something's to arise.
And that's something you need to talk to them about first thing.
Right. Right.
You've got to initiate that.
Clearly.
That's what you want to do. But I can tell you, and this is nothing against you at all, going out here and telling any of these employees how much experience you have and you did this.
That's not what it's about.
Don't do that,
Yeah,
because
that's
they
not.
will not.
That's not what it's about.
They're going to immediately dismiss that. And I'm not saying that's neither bad nor good.
Hmm.
They're just going to think, unless they are asking you, they're going to think that is you telling you're smarter.
Right, and that's not what it's about. We're in a situation where things are escalating, things can go awry, and Cammie brought up the example saying, well, if you get in a situation where someone pulls a knife or a gun on you, how do you de-escalate? It's the same thing. If you have a family member who's escalating, this is how we're going to work together as a team.
Right. Well, if
That's
somebody
what
pulls a knife on you, we're not going to de-escalate.
No.
You are going to get off the
Yes,
same here.
of course. But that's what I'm talking about, is we need to navigate scene choreography and professionalism in order to facilitate a happy customer service experience and facilitate, in your case, what I understand now, transport. The problem is when you're doing anything that shows that you're deliberately butting heads with another of your person of your own team, that shows unprofessionalism
I can
for
tell you,
RPS.
So as far as in the other places you've worked, giving them an option, we're not going to give them an option. You either go by ambulance or PLD.
Okay.
You say, do you want to go to the hospital today by ambulance? They're going to say yes or no. If they say no, we normally follow up with, if you don't want to go by ambulance, you have your family take you, but we do recommend you go get seen.
Yeah.
Whether you want to go to urgent care, but we're not going to give education before they say yes or no. You're gonna wait till they say yes or no. We don't, like, we're not really we don't, as a company, we don't talk them out of going to the hospital.
Never.
By ambulance.
Okay.
Anybody that calls 911 here, that is their emergency. It sucks, and we do have regulars. I'm sure the regular y'all ran on with chest pain was Dennis Daubert.
Mm-hmm.
I'll tell you about
In the trailer, in the RV, little mobile home. Well, not the mobile home, but it's like a
older guy.
Yeah.
Yes. We do have regulars, and they're going to go by ambulance. Where you have people that call for it is what it is. That is Alabama, unfortunately.
So yeah, you're saying from that point right there that just because it's a stub toe, you're saying that
they're still going to go by those. We're not going to ever tell them no.
Yeah, we don't say no. But the alternative would be, do you want a family or a friend to bring you? You don't even want to go down that route.
No.
See, so leadership has to tell me these things, because otherwise I would navigate a route that would give them options, because I would respect their rights. And in that
respect their rights by saying, do you want to go to the hospital by ambulance?
Okay.
They're going to say yes or no. If they say yes, okay, load them up and go. Then if they say no, give them their other option.
Okay.
But if they called you, 90% of the time they want to go by ambulance. You are going to have these calls, that family called and patient had no clue the family called. They're going to say no.
Okay. And then now I know not to even do anything with that, and just to go, apparently.
But
Just to go.
if they say yes, they're going to go by ambulance, no other options.
Okay.
We're going by ambulance.
Okay.
It's just how we've ran for however many years they've been in business. I've worked here for 13, so.
Since 1987.
That's how it's always been.
Okay.
And most services in Alabama, that's not really just to us, that's most services in Alabama, they're never going to give a patient an option to go by car.
Okay.
Unless they say no. But Carlin, get you that policy book. Reach out to me whenever you can work again after you go over that or whatever.
Okay.
And then I'll get you scheduled.
Okay.
Somebody other than Travis. Because y'all will probably buy while you with me or Lisa or somebody.
What's the game plan? Just follow Miss Calloway?
Yeah.
So, yeah, but I brought it up to her attention that I said I wanted to debrief, so we debriefed immediately after the call, just so you know that I did bring it up immediately after the call. So just in case there was something that doesn't happen to someone else, at least I debriefed immediately after. So I want to let you know that. And I notified the family.
right here when you signed your new hire paper. It's your new hire paperwork where you, when you came to the presentation about your application. Okay? So, and it goes along, there's 27 pages. Which we, you verify and do your drug screen. All these are the ones you signed in there.
Right.
Okay? Social media, your sexual harassment, 4850, you did all that. You're fit for duty. We have to send in a driver form for you. And this is all your certification. Okay? You did that during orientation. And paperwork. Right here. See how this is your orientation for employment? When you go through Paycord, now all it does is pop up, it's electronically signature, and you put your signature at the bottom, which you just tap or whatever and put your name. Alright, I'm going to copy every bit of this.
I think also one last thing is regarding the is that some of the ways that they want you to practice, for example, a primary thing is that immediately defining like the treatments that were not to treat the patient with medications and then just allow them to leave or deny transport. We need to get them. So that's always been in the protocol book. Like we don't treat, we do this, we don't do any of these things, and so I didn't see that in the protocol. So I would never know if not to have done that, because where I come from, it's rule, and they're like, oh, we're helping the community, but because that's not like in the protocol book, that necessarily, I wouldn't know. I would actually probably treat the community and help the community, because I'm always trying to think about the community. But you're saying,
I think it's coming like from California or wherever you came, more rural, out, huge. This is Walker County. We're just a mom and pop kind of organization that started, and I mean they've been running since 1990. So we're I don't know.
I think it's the diversity in protocol books, and imagine that probably, I mean, in one service at one point I was doing 2 drug boxes with 2 different protocol books. So you imagine I have at least 5, 6, 7, 8 different protocol books that I go through.
Right. Right. Yeah. And I'm not saying you don't have the knowledge. You sound like you got all the knowledge. You may have been in a meeting, the president, I don't know. You sound like you got a lot of knowledge. I'm just saying that I think it's just ran different from where you've done.
Yeah.
I'm letting that copy and copy and yeah, I'm gonna do one in the back. This is called
But I'm sure it's divided into many
it is
different
divided
things.
into many situations. I have copied the whole operations part,
Okay.
which is operations is what we consider out. Okay? So on the truck, everything's to it.
That's probably the most important thing for
I
now.
have copied them, every bit of that. This is it. It's going to tell you daily duties, responding to a call, quarter X, what you can't turn your lights on until you get to a certain place right here, it says stop sign or whatever. When you turn the lights on, your stretcher operations, stair chair, your cell phone usage, your uniform, physical education, everything. Linen exchange, I don't know what else.
No, I won't feel
Radio, traffic,
Yeah.
or whatever. I'm not sure. What else you would need. Then this is the paperwork that you sign here. There is no way I can copy that whole policy. Look, it won't fit on one of our jump drives.
Probably
It is
just the
too-
operation.
I did. I copied everything in the operations portion, but it is too big to fit on a jump drive. I can't even send it to staff like that. They had 10 of these jump drives to hold the policy. So it is not something that's easy, but it is a red book back there and should be posted in the day room. And you can ask for it next shift you want, or I can get stuff to go show you where it's at. All right. Just if you have questions after that, let me know, and then we can go from there. Okay?
So game plan is to study up a little bit and then talk to Mr. Bailey about finishing up within 2 weeks.
Yes. Follow up with me. You should call me on my cell phone, though. I got my cell phone. I've not been in this office all day.
Okay.
Call me on my cell phone. Don't call me on my office phone as much, because it may be a day or so before I get back to that.
Okay.
Okay?
All right then.